You know, reading clinical trial data is, it's a lot like reading the glossy brochure for climbing Mount Everest.
Oh, absolutely.
You get these beautiful, sweeping statistics about summit success rates, the breathtaking views, the triumph of the human spirit.
But that glossy brochure completely leaves out the feeling of the freezing wind on your face. It
Wow.
skips over the sheer exhaustion in your legs, the altitude sickness, the moments where you genuinely question why you ever started the climb.
Exactly. The clinical data is just, well, it's sanitized, which is exactly why we were tossing out the brochure today.
Yeah, we're getting into the reality of it.
We are. We're looking at a groundbreaking 2024 longitudinal study, and it tracks the messy, complicated, and deeply human real-world experiences of Canadians who received legal, compassionate access to psilocybin-assisted psychotherapy.
Which is a huge deal, especially right now.
It is. I mean, you've probably seen the flashy headlines calling magic mushrooms a miracle cure for mental health. It's like everywhere right now.
It really is. The clinical hype is deafening.
But what happens when you take the science out of a highly controlled, sterile lab and give it to a real person whose time is actually running out? This deep dive is your chance to see the beautiful, raw reality of that process.
And that's why this specific study is so vital. We aren't looking at a tightly curated experiment with perfect parameters here.
Right.
We're looking at real people facing life-threatening cancer diagnoses. They navigated an incredibly complex legal system just to try this therapy.
Okay, let's unpack this, because you'd think that the people seeking out illicit magic mushrooms would be, I don't know, young psychonauts or thrill seekers.
Yeah, that's the stereotype, but the demographic reality here is entirely different.
Right, it's completely different. We're looking at 8 Canadian patients, and their average age is about 52.
And the unifying factor among them is pretty devastating.
Yeah. Every single one is dealing with a cancer diagnosis,
Half of them are in palliative care.
meaning their cancer is incurable, right? They're actively approaching the end of life.
Exactly. And the other half are in remission, but they're living with that constant shadow that the disease might return at any moment.
It's incredibly heavy.
It is. These are individuals who are intimately confronting their own mortality on a daily basis. Their entire existence right now is dominated by the physical and psychological toll of that disease.
So they aren't looking for a recreational trip.
Not at all. They are looking for a lifeline out of profound existential dread.
And getting access to this therapy wasn't like just, picking up a prescription at the local pharmacy or signing up for a standard medical trial.
Oh no, the bureaucratic hurdle was massive.
The study details how they had to apply for something called Section 56 exemptions from the Canadian government. Basically, they had to beg the federal health minister for a special permission slip.
Right, a slip just allowing them to legally possess and consume psilocybin mushrooms.
Because these are classified as Schedule III substances, right?
Yes. Meaning the government considers them to have a potential for abuse and restricts them heavily. It's a category that carries significant legal weight and societal stigma.
And many of these patients had to rely on nonprofit advocacy groups, like Therapsil, just to navigate the mountain of paperwork.
But what the application process doesn't tell you is how hollow that victory can actually feel once you get it.
Wait, really? Why?
Well, a Section 56 exemption only decriminalized the substance for them personally. It didn't provide a safe, medically regulated way to actually buy the psilocybin.
Oh, wow. So they're just on their own to find it.
Pretty much.
Ah.
And it didn't guarantee any psychological care to go along with it either. Essentially just gave a dying person the legal right to possess an illegal substance.
Leaving them to just figure out the rest on their own. Which brings us to the financial and logistical nightmare of all this.
Yeah, the costs are shocking.
The study shows that just the application process alone costs some of these patients out-of-pocket fees ranging from $300 to $420.
And for the actual therapy sessions, in many cases, the therapists were heroically volunteering their time.
Working completely pro bono, just to help these patients who had nowhere else to turn.
Exactly.
I mean, if I'm dealing with cancer, whether it's palliative or in remission, I'm already exhausted from the chemo, the doctor visits, the emotional drain.
Of course.
Fighting through government red tape, paying hundreds of dollars just to apply, and relying on charity care to get this exemption, it sounds like an absolute nightmare. Is the sheer desperation for relief artificially inflating their expectations?
What's fascinating here is that expectation bias is a massive factor, and the researchers highlight it specifically.
How so?
When a patient fights this hard for a treatment, expending what little energy they have left, they aren't just hoping for a slight edge. They are expecting a profound transformation.
I mean, I would be too after all that effort.
Right. Combine that desperate effort with constant media exposure, portraying psychedelics as this magic bullet for trauma, and you set an impossibly high bar for the real-world application.
So they went in with sky-high hopes.
Yes. The baseline data from the study shows these individuals went in hoping for major, sweeping improvements across the board. In their depression, their physical pain, their paralyzing fear of death, and even resolving decades-old past traumas.
So you have these patients who have fought tooth and nail, spent their own money, and built up these massive expectations. But what actually happens when the red tape finally clears, they secure the substance, and the session begins?
Well, the reality of the therapy room is nothing like what you might picture.
Right, this isn't a synthesized, standardized pill handed over in a white-walled clinic.
Far from it. These patients were consuming actual raw or dried psilocybin mushrooms or truffles.
The study specifically noted some consumed a strain known as golden teacher, right?
Yes. And they were taking heavy doses, ranging from 2.5 to 5 grams, often eating them whole or brewing them into a tea.
That is a serious dose.
It is. The setting was designed to be supportive and naturalistic. They were surrounded by guides, often 3 or more therapists or facilitators per patient.
Which is necessary, I assume, because the patient can entirely lose their grip on consensus reality.
Exactly. They were listening to specifically curated, recorded music, wearing eye shades to direct their focus inward. And many brought sacred or personally meaningful objects into the room with them.
So the environment was incredibly supportive, but the physical reality of the session, it was an absolute gauntlet.
It was absolutely not a relaxing spa day.
Not at all. The post-session data, which they collected from 5 of the participants the very next day, reveals just how brutal the physical toll is. 80% of them experienced severe nausea or vomiting.
And 60% reported crying, intense headaches, and sweeps of sweats and chills.
Some even reported deep body aches and uncontrollable trembling.
And the psychological challenge mirrors that intense physical disruption. Every single participant in that post-session group found the experience psychologically challenging.
Every single one.
Everyone. One person even rated it as the single most difficult or challenging experience of their entire life.
Let that sink in. These are individuals who've gone through cancer diagnoses, grueling chemotherapy, and the terror of palliative care.
And they were saying this mushroom trip was the hardest thing they've ever been through.
Okay, I have to push back here. This sounds less like a peaceful healing retreat and more like psychic surgery without anesthesia.
That's a good way to put it, actually.
If 80% of them are throwing up, crying, sweating, and calling it the hardest day of their lives, why is the medical community calling this a treatment?
To understand that, you have to look at the brain's defenses and how this substance dismantles them.
Okay.
In this therapeutic model, the healing doesn't happen in spite of the agonizing challenge. The healing comes directly from the challenge.
So the difficulty is the point.
Exactly.
Yeah.
Psilocybin essentially quiets the part of the brain that maintains our ego and our defensive walls. The researchers measured this using the Emotional Breakthrough Inventory, or the EB.
The ED, right.
Yes. The EB is a psychological tool designed to measure how much a person overcomes their emotional resistance and fully surrenders to difficult feelings.
And what did the patients report?
They overwhelmingly reported that the treatment forced them to face the existential terror, the deep grief, and the anger that they usually spend all their energy repressing.
Wow. So it's active, agonizingly hard work.
It is not an escape from reality. It is a forced, unshielded confrontation with it.
Which brings us to the aftermath. They run this grueling physical and mental gauntlet. They confront the terror of their own mortality head-on. 2 weeks later, the researchers follow up with them. The dust has settled. Did that agonizing psychic surgery actually pay off in a measurable way?
For the vast majority of them, it absolutely did. The study showed significant, highly quantifiable decreases in anxiety.
They measured this using the GAD-7 scale.
Yes, the GAD-7, which is essentially the clinical gold standard for measuring generalized anxiety disorder.
And seeing a significant drop on the GAD-7 means a patient might go from feeling paralyzed by daily panic to actually being able to sleep, converse, and find moments of peace.
Precisely. They also saw significant drops in depression symptoms and even self-reported physical pain.
And remarkably, they found a decreased fear of COVID-19.
Yes, that was a really interesting finding.
Keep in mind the context here for you listening. This survey was conducted during the height of the pandemic, and these are highly vulnerable, severely immunocompromised cancer patients.
To have their fear of a deadly virus drop is astonishing.
It really is. But beyond just reducing the negative symptoms, the positive additions to their lives were massive.
Their overall quality of life, specifically their psychological quality of life, saw major increases.
And their spiritual well-being, which the study measured across dimensions of meaning, peace, and faith, just shot up.
The researchers utilized the mystical experience questionnaire for that, tracking feelings of unity, transcendence of time and space, and deep interconnectedness.
Based on that clinical scale, 2 of the participants reported having a complete mystical experience.
They touched something entirely outside of their daily suffering.
But right in the middle of all these incredibly positive outcomes, we hit a massive contradiction in the data.
Ah, yes, the MAID paradox.
The MAID paradox. For context, MAID stands for Medical Assistance in Dying. It is a legal, regulated, and accessible option for Canadians facing grievous and irremediable medical conditions to choose to end their lives on their own terms.
And we need to be clear, for you listening, we're simply reporting the data here.
Yes, exactly. We are absolutely not taking any stance on the ethics or policies of MAID itself. But the researchers asked the patients about their attitudes toward medically assisted dying before the therapy and then again after.
And the hypothesis going in would naturally be that if a patient's depression drops, their anxiety drops, their physical pain is reduced, and their spiritual well-being skyrockets to the point of a mystical experience.
They would be much less inclined to seek an early medically assisted death.
Yeah.
Right. So what does this all mean? If you cure the anxiety about dying, shouldn't you want to stick around longer?
You would think so.
It's like fixing a leaky roof, entirely remodeling the kitchen, installing beautiful new windows, and then still deciding to sell the house.
That's a great analogy.
Why put all that incredible work into finding peace only to keep your appointment with the exit door? Are they just making the exit door less terrifying rather than making them want to stay in the room?
If we connect this to the bigger picture, this paradox forces us to entirely redefine what spiritual peace actually looks like at the end of life.
How so?
Previous studies have generally suggested that higher spiritual well-being usually correlates with a decreased desire for a hastened death. But here, the desire for hastened death remained entirely unchanged.
So they didn't change their minds at all?
Nope. They remain just as likely, just as certain, and just as at peace with their decision to use MAID as they were before they ever took the mushrooms.
That is wild.
It is. Finding profound spiritual well-being does not necessarily mean stubbornly clinging to biological life. For someone with a terminal diagnosis, true spiritual peace might actually manifest as a profound, clear-eyed acceptance of their natural end.
Because the therapy didn't magically cure their cancer.
Right. And it didn't change their pragmatic plans for how to handle the inevitable physical decline. It simply removed the blinding terror surrounding it.
That is incredibly heavy, but also, strangely beautiful.
It really challenges the traditional medical definition of what a successful outcome is.
It does. Success isn't always about extending life. Sometimes it's about transforming the quality of the exit.
Absolutely.
But look, if you're listening to this and thinking, well, I wouldn't take that risk, this sounds incredibly intense, you are not alone. And the data actually backs up that hesitation.
It does. We have to look at the whole picture.
If we are going to be objective, we must deliberately hit the brakes here and look at the data point that breaks this entire success narrative.
Right. Out of the 8 participants who completed the full baseline and endpoint surveys, there was one glaring exception.
One person who didn't get better.
One participant reported a major worsening across multiple crucial domains. 2 weeks after the session, this individual reported that their depression, their paralyzing fear of death, their spiritual well-being, and even their social relationships with their own family and friends.
All of it was worse.
Yes. All of it was significantly worse than before they ever tried the treatment.
Wow. Imagine fighting through all that red tape, paying the fees, enduring the nausea and the terrifying session, only to come out the other side feeling even more disconnected and afraid of dying than when you started.
It's heartbreaking.
Why did this happen? Here's where it gets really interesting. We are basically watching the live beta test of a brand new medical paradigm.
Yes, we are.
In a highly controlled clinical trial, patients are rigorously screened. If you have a hint of contradictory psychiatric history, or if your trauma is deemed too volatile for the current protocol, you are excluded. The safety nets are incredibly tight.
But compassionate access programs, by their very nature, are designed for the people who fall through the cracks.
Exactly. They do not have those same strict guardrails.
And the authors of the study issue a very stark warning regarding exactly this point. Taking the science out of the clinical trial brochure and putting it into the real world is dangerous.
Because of the variability.
Yes. When you have desperate patients navigating government loopholes, taking non-standardized doses of organic mushrooms instead of synthesized pills, the variability is massive.
And while they had incredibly dedicated therapists sitting with them, relying on healthcare workers to provide this highly intensive, emotionally draining care pro bono is simply not a scalable public health model.
It's not sustainable at all.
You can't just hand out magic mushrooms without the magic of a highly trained, standardized, and well-funded support system. It raises a very uncomfortable question. Are we moving too fast?
That's a valid question.
Are we letting desperate people bypass the necessary safety nets of a clinical trial because we are so eager to offer them a miracle?
The researchers absolutely echo that concern. If legal access to psychedelics continues to expand globally, which is currently doing, the lack of standardization is a serious hazard.
What needs to change then?
Well, without formal surveillance programs to track these negative outcomes, without standardized symptom assessments before and after, and without clearly defined rigorous therapist training, the risks of adverse psychological events are highly magnified.
It makes sense.
The drug opens a door in the psyche, and if the patient doesn't have the proper sustained support to process what comes through that door, they can be left in a much darker place. It is a wildly volatile tool.
And that volatility is what makes this study so vital. We are looking at the immense bravery of 8 Canadians who paved the way.
They really did.
They ran a grueling, nauseating, and terrifying physical and mental gauntlet. For most of them, that trial by fire led to undeniable, quantifiable improvements in their anxiety, their depression, and the overall spiritual quality of their remaining days.
But it is not a magic wand.
No, it requires immense respect and a highly structured support system to be administered safely.
Power always carries risk.
Absolutely. Even if you aren't facing a life-threatening illness yourself, this deep dive fundamentally shifts how we view mental health and healing as a whole.
It challenges the modern, sanitized idea that healing is always supposed to be comfortable, or that therapy is just about feeling relaxed and validated.
Sometimes the only way out of our deepest, most paralyzing anxieties is to literally walk straight through the fire of our own suppressed fears.
It certainly leaves us with a lot to consider about the future of medicine and the limits of our own resilience.
Yeah.
What if the ultimate goal of future psychiatry isn't just to extend the length of our lives,
Right.
or to artificially induce happiness by numbing our pain with a daily pill?
That's a profound thought.
What if the true frontier of medicine is helping us face the hardest, most terrifying realities, including our own inevitable mortality, with clear-eyed courage?
Wow.
If there was a therapy that didn't save your life, but made you entirely at peace with losing it, would you take it?
Thank you for joining us on this deep dive into the real-world data. Keep questioning the headlines, keep exploring the science, and remember that the reality on the mountain is always far more complex and far more human than the glossy brochure suggests.